Hi everyone, welcome to PEX Express. My name is Beth Franklin and I'm the Patient Experience Manager here at Norton-Brownsboro Hospital. Today my special guest is Katie Kentner. Katie is the Director of Surgical Services. She has a very important topic that she would like to discuss, and I am really looking forward to hearing what she has to say. Here's Katie.
Hi everyone, I'm Katie Kentner, Director of Surgical Services at Norton-Brownsboro Hospital, and today I'm going to talk to you all about bedside handoffs or handoff communications or bedside report, all which are appropriate terms to use. Did you all know that the Joint Commission said that 80% of all medical errors start with miscommunication? That's 80%. So what I'm going to talk to you all today about how we can avoid that. So one of the things that we do in the surgical world, we have multiple handoffs. So it starts in pre-op, and the pre-op nurse gets the patient ready. And then we, after we get the patient ready and we talk to them, we always use the two identifiers. One, patient's full name, two, the birth date. We always use the two identifiers. When the circulating nurse or the block room nurse comes to get the patient, they always ask the two identifiers. What is your full name and what's your birth date? We then look and make sure that we have all the lab work done. We check for consent. And if we have a right or left, we make sure that the physician has marked the patient with his signature on the affected side. And we also check to make sure the consent matches what the patient tells us. So the patient may go to the block room for a spinal or a regional block, and then from there go to surgery, or they may go straight from pre-op to surgery. When the circulating nurse gets the next handoff, they do the same thing. They ask for the patient's full name and the birth date. Then they talk to them about MPO status. The two nurses, whether it be the block room nurse or the pre-op nurse and the circulator, discuss lab work. They look at the consent together. They check the patient's ID along with asking the name and the birth date and any other pertinent information. And they always look at the, if it's a left or a right, they look at the mark on the patient's left or right side that the surgeon made. When the patient is taken to the OR, there is another handoff. Right when they come in the room, they ask the patient if they're able to state their name and their birth date and what we're doing today and who the surgeon is. That's for the people that are in the room, such as a surgical tech setting up the case, so that they can hear that also. Before the case is started, once the patient is prepped and draped and whether or not they're asleep, there is another handoff, but it's called a timeout, and that's when the nurse and the doctors and the tech and anesthesia all stop what they're doing and they state the patient's name and birth date, you got it, and they discuss that what the procedure is, who the surgeon is, whether or not they have all their equipment available, if everything is ready to go, if it is a left or right, if they see the mark on the patient, the signature of the doctor on the affected side. And they also discuss a fire risk for us because we have flammable liquids that we use. We have a high-rich oxygen environment, and we also have equipment that produces electrical sparks. After the surgery, the patient is taken either to phase 2 if the patient was semi-awake or had a regional and they don't require going to recovery room, or they go to recovery room. Here they get almost a dual handoff between the anesthesia provider and the circulator. The circulator talks about the procedure, what kind of lines and drains the patient may have, how they did during the surgery, look at the dressings, and things like that. And yes, they start off with the name and the birth date when they're given that handoff. The anesthesia provider talks about whether or not the patient was intubated, whether or not the patient had a regional, what medications that they got, and also any other pertinent information that's related to anesthesia. And what kind of pain medicine. Sometimes when the patient wakes up, they may give pain medicine right in the OR before bringing to recovery room. Once the patient is recovered, there is another handoff. You guessed it. It's either to the phase 2 nurse from recovery room to phase 2, or it's to the floor. It's always a bedside, and it's always the same thing, the name and the birth date. And then they talk about all the pertinent things related to surgery. What kind of surgery they had, how they did, what kind of pain medications that they had, and anything else that is pertinent to the patient. This is always done at the bedside because it allows the patient, if they're able to interject, and the patient can say, don't forget, I get really nauseated after surgery, or I'm going to be due for my pain medicine pretty soon. But it allows the patient to not only to interject and give their feedback or give information, but it also lets the patient know that everybody here is performing as a team and that we all are coordinating their care, and that makes the patients feel better about their care here and they feel safer. The last handoff that can happen if a patient goes home, and that handoff happens to the family member or the person who's taken the patient home. This is when education is provided and any pertinent information that the family member needs to know, because most of the time our patients, they may walk in here, but they come out, they've had surgery, so they are all altered, and sometimes they just don't have a lot of memory because some of the medications that we give them. So we have to give a handoff to someone who is going to be responsible for that patient, and that is the final handoff. So as you can see in surgery, we have multiple handoffs daily with each patient, and I feel like we're pretty good at what we do. But don't forget, you always want to use your two identifiers, your name and your birth date, always for your patients. Thank you.